my name is Anthony Fernandez. I am the Director of Medical Dermatology and the W.D. Steck Chair of Dermatology at the Cleveland Clinic in Cleveland, Ohio. Sure, I had the pleasure of presenting a keynote speech concerning the hot topics in psoriasis. And I think that there are three hot topics that are particularly important for physicians to be aware of. First of all is the joint alignment between the International Psoriasis Council and the National Psoriasis Foundation concerning how we define disease severity in psoriasis, where we no longer believe it's appropriate to just assess severity based on body surface area involvement, but we want to assess based on whether or not our patients qualify for systemic therapy. And that doesn't necessarily require a significant amount of body surface area involvement. And I think because those two organizations are aligned, it's going to allow us to more readily get biologic medications and other novel systemic agents for all of the psoriasis patients whom we feel need them, and that's going to improve patient outcomes. The second hot topic has to do with latent tuberculosis screening prior to initiating a biologic or while taking biologic. And again, there is now a joint position statement by the International Psoriasis Council and National Psoriasis Foundation really stating that we don't have to do latent tuberculosis screening for our psoriasis patients who are planning to or who are already taking interleukin-17 and interleukin-23 inhibitors, because the data doesn't support that there's risk of reactivation of latent tuberculosis. That statement leaves open the option to still check for latent tuberculosis in any patient whom you think it should be ordered in, but it's not necessary. And then finally, the third topic has to do with GLP-1 receptor agonist therapy in psoriasis patients. This is one of the hottest topics in psoriatic disease. There has been a lot of press and weak research suggesting these medicines may be beneficial to psoriasis patients, but more recently, within the past few weeks, there's been release of data from a well-designed study looking at combination of tirzepatide and ixekizumab versus ixekizumab alone for treating psoriasis. And the data supports that adding a GLP-1 receptor agonist can be beneficial in terms of the likelihood a patient can reach a PASI 100 score or be completely clear. So I think the results of now a well-designed study really suggest that we should think about the possibility of a GLP-1 receptor agonist in the appropriate psoriasis patients. I think what I am most excited about is the data concerning brepocitinib, which is a dual TYK2/JAK1 inhibitor oral medication for treating dermatomyositis, which is a relatively rare autoimmune disease that has a lot of similarities to lupus erythematosus. Dermatomyositis is a disease that I see frequently on almost a daily basis in my practice, and I can tell you that there has long been an unmet need for novel medications that can effectively treat these patients. And the data from the phase 3 trial looking at brepocitinib as an option for those patients, really exciting data. And we expect in the United States to get approval for this medicine maybe as early as the end of the summer. Any of us who treat patients with dermatomyositis are looking forward to the date when we can just prescribe it straight from our clinics. I do a lot of research in autoimmune diseases like lupus and dermatomyositis, and I will be continuing to do that. We are involved in other clinical trials right now looking at really elegant novel medications as treatments for both dermatomyositis and cutaneous lupus erythematosus. And hopefully within the next few years, the data from those studies will be presented at this annual meeting, and we hope that they look as good as the data does for brepocitinib, and we have even more elegant medicines to offer to our patients. And then in psoriasis, at the moment there aren't many studies looking at biologics that are occurring, but I expect that there will be more in the future. Despite having outstanding medicines for our psoriasis patients, we always look forward to the day when we can offer them even better options.